I got my PhD in pharmacology from the University of Georgia. Actually, Georgia and Alabama is where I grew up, so I've mostly stayed in the South for most of my life. I did my postdoctoral training at the National Cancer Institute in Bethesda, Maryland. My research background is in breast cancer chemotherapy, so I worked on novel chemotherapeutic drugs, mostly for breast cancer, has been my research background, but really I've been teaching for a long time. About 15 years ago, I started teaching for Kaplan. Had a great experience, been able to travel all over the world. Through our live online classes, I'm able to reach students really all over the place. So I'm going to give you a way to remember the inducers and the inhibitors. This was just my way that I always use to remember. So let's start with the inducers. You know, when I think about being induced, I think about being kind of jacked up, being ready for something. I want to be pumped up. So what's going to induce me? Well, this is how my day starts. I start with smoking and drinking. I mean, that's just a way to wake myself up. Smoking and drinking, because cigarette smoke and chronic ethanol, right? Cigarette smoke and chronic ethanol, those are inducers. You know, when I smoke and drink, I have to have a place to do that. So I smoke and drink in Barb's car because Barb let me use her car. I appreciate that. Barb is barbiturates, like phenobarbital, car, like carbamazepine. So smoking and drinking in Barb's car. But apparently when I smoke and drink in Barb's car, it riffs her fin. Riffs her fin. I'm not even really sure what that means. I don't think Barb is happy with me right now, right? But rifampin and phenytoin. Rifampin and phenytoin. So when I smoke and drink in Barb's car, it riffs her fin. Those are my classic P450 inducers. And feel free to modify that any way you want. But let me tell you this. Out of that list, I have two favorites. I have two favorites. My two favorites are carbamazepine and rifampin. Carbamazepine and rifampin. Now, carbamazepine is one of our anticonvulsants. It's a sodium channel blocker. It's not a benzo. Yeah, so carbamazepine is kind of like phenytoin, very similar type of drug. Both are P450 inducers. But I like carbamazepine and rifampin as the two most likely to show up in questions. Then when it comes to inhibitors, right? Inhibitors, I think, well, what would inhibit me? Apparently I can drink ethanol, right? I can drink a couple of beers and I'm fine with that. But if you make me a mixed drink, apparently I'm going to be inhibited. And my mixed drink consists of the wonderful ingredients Coke and grapefruit juice, because I'm a wild man. Coke and grapefruit juice. Now, Coke is a mnemonic. Coke is cimetidine, omeprazole, ketoconazole, erythromycin. Cimetidine, omeprazole, ketoconazole, erythromycin. All four of those are P450 inhibitors. Grapefruit juice, P450 inhibitor. Well, if I'm going to have a cocktail, if I'm going to have a mixed drink, I might as well have something to go with it. So Coke and grapefruit juice with my pie. Now, PI, that's a protease inhibitor. Protease inhibitor. Because, of course, if you eat a lot of pie, that'll shut you down as well. Protease inhibitors, drugs like ritonavir for HIV. So one more time, Coke, cimetidine, omeprazole, ketoconazole, erythromycin, grapefruit juice, and protease inhibitors. Now, out of that list, my favorite of the P450 inhibitors, I like cimetidine. Cimetidine's over the counter, and it interacts with about 700 drugs. Cimetidine for peptic ulcers, lots of drug interactions. I like erythromycin. Macrolide antibiotics are very important. Erythromycin as one to note as well. In fact, speaking of macrolides, here's what I want you to do with your macrolides. It's kind of a separate note, but related. With your macrolide antibiotics, there are three that are very popular today. And I want you to take those three drugs and put them in alphabetical order. The three macrolides are azithromycin, clarithromycin, and erythromycin mentioned on this slide. One more time, azithro, clarithro, erythromycin. If you put them in alphabetical order, you've actually just organized them from least to most P450 inhibitor effects, right? Least to most P450 inhibitor effects. So the macrolide that is very popular today, but doesn't have any drug interactions, azithromycin. The macrolide that has the most drug interactions, erythromycin. And then, of course, the one that has some P450 effects, that's clarithromycin. So if you're thinking about a drug interaction question, it's probably erythromycin in that drug interaction question. It could be clarithro, but it won't be azithromycin because that one really doesn't have the P450 effects. All right, is that clear? Does that make sense to everybody what we just did there? So you put them in alphabetical order. You put them actually in the order from the most popular because it has no drug interactions to today the one that's less popular because it has more drug interactions. Also on this page, in the margin is a note about grapefruit juice. And grapefruit juice is a P450 inhibitor. And grapefruit juice can interact with lots of different drugs, and that includes statins. In that long note in the margin, about halfway down is the drug atorvastatin. You might want to highlight atorvastatin. So if you're taking atorvastatin, you're doing that because you have high cholesterol, right? You got high cholesterol. And besides telling your patient to take atorvastatin, you tell them to change their diet and to exercise more. Now let's just play along for a second and imagine the patient is actually going to listen to you. So they exercise more, awesome, and they change their diet, great. But sometimes they make changes and they don't tell you what they did. Like, what if this person had a friend that came along and says, oh, I noticed that you're trying to eat healthier. You should eat grapefruits because I heard that eating grapefruits or drinking grapefruit juice is really healthy for you. And you go, hey, I'm trying to be healthy. I want to eat grapefruits or drink grapefruit juice. And so you start doing that every day for breakfast. Now, what's going to happen to the plasma levels of the statin? If you're drinking grapefruit juice or eating grapefruits every day, the statin plasma levels go up. And now that person comes back to your office, and you know what they're complaining of? What are they going to complain of at that point? They're going to complain of muscle pain, muscle soreness, muscle pain, myalgia. Yeah, because of increased plasma levels of the statin. So that's an interaction that could occur. It certainly could occur. Now, here's a caution for you. I'm not trying to scare anybody. Here's a caution. You know, grapefruit is not the same thing as grape. Right? If you get an answer choice and it says grape juice, please don't do this. Don't look at that answer choice and go, I'm pretty sure they meant grapefruit, because I'm pretty sure they didn't mean that. Right? Grapes and grapefruit are not the same. See, one of them's about this big, one of them's about this big, right? The big one is the grapefruit. That's the one that has components that inhibit drug metabolism. If you're eating grapes, listen, I'm not saying that they're going to do evil things to you on your test. I'm just saying because it looks the same doesn't mean it's the same, right? It's not the same. Yeah, no doubt about it. No doubt about it. And by the way, you have to do that on a regular basis. You have to eat grapefruit almost daily or drink it almost every day in order for it to have a major drug interaction. If you just eat one occasionally, drink the juice occasionally, no big deal.